No, ini bara.
Okay.
Welcome.
Basically, lots of Lala Mialonko is cool, man, that I can really relax.
What the madam?
Yeah,
What the madam?
Yeah.
Let them do somebody.
That's right.
Grand Villa.
Grand Villa.
That's fine.
Slowly. Yes. No.
Yeah, actually, a lot of people are basically Mialonko is very relaxed. So the two things that I can understand.
Nina from Nisewa, Nidia, Nena Grand Villa is the best guest house in the Gambia.
Beji andika Grand Villa Guest House. Na labungul bebe senyaring adu na bungul bebe nyarandiring coming ibe la fila ila suwe taranyame. Ntel Grand Villa na kiliano la lafino wale mukangwati ntel kang. Na ye sabati Grand Villa yela kodo na fa kalamuta.
Oh man, this is like a paradise.
I know.
I so much love this place.
Thank you.
Trust me, I love this place.
You can move somebody and watching what?
Yeah.
I know the Gambia. Grand Villa.
I tell you. I love this place. Okay. I love this place, man. Oh yeah.
Ni lefta na kuo keso sotola. Futama Oljuntum Paradise Estate. Mbaya kumandiroke 7527-218. Wale futana website auto www.grandvillaguesthouse.com. Grand Villa Guest House.
Dreaming of owning a property in a prime location with great proximity and fantastic neighborhood? EJ Investments Sanyang Seaview Estate is the best choice you have been waiting for. Our Sanyang Seaview Estate is approximately 15 minutes drive away from the busy hub of Brusubi roundabout and into the heart of nature, where you can have a peaceful and relaxed lifestyle with your family. You can buy a finished 4-bedroom story with 5-year flexible payment plan or a service plot with 2-year payment plan option. With over 300 homes, you will enjoy big tar roads with covered drainage, modern electrification with solar street lights, gated entrance with security post, and a breath-catching experience of our beautiful sea view and lake view. You can own a home today at our Sanyang Seaview Estate. Call us today on 446-4838 or 325-9220. Visit our website on ejinvestments.net. EJ Investments, first in property.
Yara nyilla domoro kadiyate
boy jannon sikes restaurant
e say nakko be ninna dimbal nimbe domoro kala janno
domoro seneyata adiyata topotoro fanan kendema bije luntan during tamala abeka domoro ki janni adi manda wala de teka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo fendin lon dunia kono domoro betama ñillom international o toda number 1
amanke ba do la jandama
e sa do jang is atariya
wo mu kubandi
sa na ko sa futandin
oto sa na ko be mu CK's restaurant
ndafa na janna mu yat ni manje do mbija
aban
CK's restaurant, known for best quality food and customer satisfaction.
Honey, did you remind him that the last time he sent the money, it was not enough to buy all the provisions?
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baluwo?
Baluwo? What is Baluwo?
Baluwo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baluwo works.
It's very simple.
Just log on to baluwo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baluwo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria or Mali. Baluwo, better than sending money.
Makes sense, does it? Doesn't it? I think it makes sense. It's better for everyone.
Good afternoon, all of you as usual. We are here, the Honorable Minister of Health, Honorable Ramadan Samate, to give a press statement with regards to an update, what we are doing, where we are, and where we want to go with regards to the issue of discussing around COVID-19. That's why we call you, as usual, to distribute our several of the presidents we have been having. So he's going to make a statement, and after that we'll also invite a few questions, and then we can go into the session. Honorable Minister, you are welcome to give your statement.
Thank you very much, Mr. Njai. The Ministry of Health wishes to inform the general public that the Ministry, in collaboration with partners, is effectively coordinating the COVID-19 interventions through the National Health Emergency Committee and various subcommittees. The 9th National Situation Report, since confirmation of the first case of the novel coronavirus disease, COVID-19 in the Gambia on the 17th March 2020 revealed the following. 1, the Gambia records no new case or no new laboratory confirmed COVID-19 case as we speak. I repeat, the Gambia records no new laboratory confirmed COVID-19 case. 2, the repeat sample for the probable case, that's the co-traveler to the diseased case, tested negative. I repeat that again, the case that was thought to be a probable case has tested negative. 4 new samples tested on the 27th March 2020, all tested negative. Cumulatively, the country still has a total of 3 COVID-19 confirmed cases. All 3 confirmed cases were imported with no epidemiological link to each other as mentioned earlier. The 2 confirmed cases are still under treatment and are responding well. Africa has continued to see an increase in the number of cases from 1,937 on the 26th March 2020 to 2,419 on the 27th March 2020. The number of deaths so far is 39 in Africa. However, this has been on the rise. The number of cases in Senegal as of 27th March 2020 stands at 105. That's an increase of 6 cases. Currently, we have 248 people on quarantine at various locations in the country, and they are all safe and in good condition. A total of 61 tests were conducted and 3 were positive. 59 test results were negative. We are working with our partners to maintain the gains registered in the area of logistics and safety. A number of treatment sites in the country are being upgraded. Currently, a total of 100 security personnel are available to support response activities by the Joint Operations Center excuse me, at quarantine facilities in the country. Maybe I need water. Regarding risk communication, a total of 27 TV and radio programs. I think we need to take a break. Yeah. Yeah. So next time, maybe we need a bottle of water around. Yeah. Ani modi be kabol.
No, ini bara.
Okay.
Welcome.
Basically, lots of Lala Mialonko is cool, man, that I can really relax.
What the madam?
Yeah, that's
what the madam?
Yeah.
Let them do somebody.
That's right.
Grand Villa.
Grand Villa.
That's fine.
Slowly. Yes. No.
With our partners to maintain the gains registered in the area of logistics and safety. A number of treatment sites in the country are being upgraded. Currently, a total of 100 security personnel are available to support response activities by the Joint Operations Center at quarantine facilities in the country. Regarding risk communication, a total of 27 TV and radio programs were conducted across 5 TV stations and 12 radio stations as well. 1,470 posters were donated by UNICEF to the Ministry of Health. 2 video spots with sign language messages developed by UNFPA are handed over to the Ministry of Health. Various religious scholars have taken the forefront in the COVID-19 message dissemination. 5,000 posters and 2,500 leaflets developed and produced by the Ministry of Health were distributed to the various regional offices for further distribution to the various centers and various communities. Social media guidelines were developed and in use to monitor media publications. 2 press releases were made to refute fake news on COVID-19. Today, we received from the Jack Ma Foundation 20,000 test kits, 100,000 face masks, 740 protective clothing, and 1,000 sets of protective shields flown in by the Ethiopian Airlines, courtesy of the Ethiopian government, and also courtesy of the World Food Programme in collaboration with the WHO. And these donations were from the Jack Ma Foundation, also in collaboration with the Alibaba Foundation. This will go a long way in enhancing our response. There has been a large volume of calls to the toll-free number 1025 hotline, and the summary of calls received on the 1025 as of 27th March 2020 revealed 468 calls, whilst 23 of these calls were referred to the contact tracing team, out of which 15 contacts were traced. The ongoing, the ongoing U-Report platform poll has found out that 45% of the respondents prefer COVID-19 related information shared on TV. Regarding our next steps, the Ministry will intensify sensitization activities using various channels of communication at all levels. We'll continue to build capacity of health workers on case management, laboratory techniques, surveillance, psychosocial support, and risk communication. We will expand the COVID-19 testing facility to the National Public Health Laboratory BSL-3 lab in Kotu. Very soon, this lab will be up and will be conducting COVID-19 testing. We'll also continue to monitor and respond to the rumors as and when they occur. We'd like to appeal to you, the general public, for your continuous support and collaboration in the successful implementation of COVID-19 surveillance, including contact tracing, rapid response, and risk communication to strengthen the community-based surveillance at all levels. I would like to take this great opportunity on behalf of the government of the Gambia to thank all health professionals and security personnel for the hard work and sacrifice you are all doing for the people of this country. I wish to thank all the partners, government departments, the private sector, municipal and area councils, as well as the communities and the media fraternity for the support and collaboration in our collective efforts against COVID-19. Together, we can make a difference. I thank you very much for your kind attention. Thank you very much.
It's evidence how fair we are basically struggling on the front line. Because some people think that we are enjoying it. We don't even have adequate water to drink, let alone food. So thank you very much. We invite the media. We take 2 or 3 questions.
Thank you very much. Honorable Minister, there are some concerns reaching us out at the newsroom that the Gambia government or the Ministry of Health is not conducting as much as expected number of tests. Looking at the number of cases in Senegal, 105, and both the first and the third case in the Gambia having to come into the country through an airline that also brought in along other people. So is this also a weakness on the side of the ministry that not many tests, actually not more than 100 tests have been conducted so far in this country?
Yeah, thank you very much. Of course, you know, when we do testing, we have to follow the laid down rules when it comes to testing people. So certainly we have very competent people who look at those who need to be tested. There are guidelines, WHO guidelines, that countries go by to look at who needs to be tested. And when those guidelines are followed, and as our people, I know our people are following those guidelines, that is what is determining the number of tests that are being done. But I assure you that whoever needs to be tested will be tested. There are various things. It's not that people just go around testing everybody. You know, even the developed countries do not do that. Of course, our threshold for testing is pretty low. In fact, that's why we have the number of cases that we are tested. Any case, in fact, many of the cases that even under the WHO guidelines are not thought to be suspected cases by definition, but when we think they're high risk, we test them. So our testing threshold is pretty low, and our experts look at that. They review it every day, and if there is need for more tests to be done, the test will be done. You realize that we even have quite a lot of test kits here now, and the test kits we have had ever since are still being used and are not exhausted. So it's not an issue of not having enough test kits or not having enough personnel or enough capacity to do the test. We are doing it based on the guidelines. Thank you.
On the issue of privacy on the patient, what is the rule from the Ministry of Health? Because I interacted with those at Marcus in regards to the Bangladeshi and the second case, which was subjected to test, that you can say is negative case. They felt that the brotherhood there is discriminated, and they express disappointment that, you know, everybody's pointing finger on them. So I just wanted to ask on the principle of privacy when a case is actually confirmed positive.
Thank you very much. I think our people have been acting, all of us, including myself, I believe, very professionally when it comes to respecting the human dignity. We all train to respect the dignity of the people we deal with. We do not see them in any negative manner. We rather see them as people who need our help and who need the attention and care from us. So we see them in that way, and we want all the people, the population, to see them equally as people who actually need help. When people are sick, what they need is compassion. They need help and respect and dignity. So that's what we put forward towards them, and we expect the entire population to see them that way. And with the issue of sickness, I think who knows, you know, who is going to be sick next. We all pray against it, but when people are sick, they deserve the respect, and we accord them that respect and, you know, dignity, right? When it comes to the privacy, well, I believe the privacy is maintained. Do you know the gentleman who was affected? Do you know? You know, the messages that are sent across are not identifiable. You cannot identify, you cannot relate that message to a particular individual. His name was not mentioned. You cannot know who it was. Sometimes certain information have to be pronounced for surveillance reasons. If that was not mentioned before, probably the precautionary measures people took, they wouldn't have taken them, and then it could have it could have resulted to something else. So certainly the privacy is important, but when it comes to public health, there are times when you have to mention certain things to protect the general public. And I think our people have been following all those rules, all those guidelines. That was a community where it was found, and the announcements were very, very important to help the people of that community, first and foremost. The announcements really were to help the people of that community, first and foremost, so that they are aware of this, so that they come together, so that they are observed, so that so that if any of them happens to develop a symptom, he could be taken for care immediately. But also so that if any of them happen to be infected, his family is protected. Because people tend to spend a lot more time with their families than with outsiders. So the first person to be protected, to be helped, is the individual who is a contact. But also, more so, his closest family members who live with him. And I think it is in their own interest to get to know the risk that they were faced with, so that they take precautionary measures to protect their immediate families, of course themselves, so that the symptoms, if they occur, are detected early for them to get treatment or for them to get some attention of some sort, any attention that's available, and also to protect their immediate family members and the community at large. So the information that was released was in the same spirit, not to humiliate anybody, not to belittle anybody. We respect all the people, we respect everybody, and nobody can disrespect people because of disease, because no single person owns a disease. When diseases of this nature, it takes collective efforts and collective responsibility. Thank you.
So as to what the Honorable Minister said, as you say, we are following international standard best practices and the information that has been released so far. We protect the privacy. And the Bangladeshi thing that you say, the location is mentioned as the Honorable Minister said, for public health reasons. But the government did not receive the personal data. Some people released the picture and other things, but the name is still not known. The copy of his passport is still with the government. And we are protecting, we are jealously protecting people, because we understand that they have to be reintegrated into the society. Because after the response phase, we have the recovery and reintegration phase that is going. So we are all going back to the community, and it's important. It's not the government. Any information that is coming out, it's like I suggest, because people are hungry, they put something out there. But from our side, as the minister said, and I can confirm that we've been following the professional standard, and the privacy is number one, that we look at. But any information released, it's necessary, as the minister said, in order to reach it out. So I have one more question.
I'm Rachel from the Foreign newspaper. With regards to quarantine, I often hear most of the time from the society, people will just automatically say, when we're on quarantine, we are isolated, automatically we are positive. Because oftentimes we hear them saying that. What message or advice do you have to clear that misconception from the society?
Yeah, so it's not automatic that the individual is positive. The idea is to observe them so that if any of them shows symptoms and signs of the disease, it will be picked early. But also so that unknowingly other people in the community are not affected. Because if a person is infected, and we have all known now that people, even without showing symptoms, can infect other people, if they are not quarantined, if they are not separated from the rest of the population, unknown to them, they could be infecting more and more people. But you get to realize that so putting people on quarantine is like a safeguard to help they themselves, so that the signs and symptoms are picked pretty early, because they are checked every day. They are monitored every day. So if they develop those features, it will be picked early, so they get medical attention quite early. But also to protect their families and the general public. So you see, it is highly beneficial to everybody in society. So it is a necessity. It is not that, I said that before, that the government enjoys to put people under such situations. We know it is not easy. It is not convenient. Being confined to a place for 2 weeks is not convenient for anyone, but it is a necessity. And we appeal to them. Many of them understand, really, but we appeal to them to continue to understand and to continue to be patient. Inshallah, very soon it will be over, and they will all join their families, in a healthy state. The community should also know that undergoing quarantine doesn't mean that the people are positive. I emphasize that. It doesn't mean that the people are positive. And we even applaud the people who have agreed to undergo quarantine. It is mandatory though, because that's what the law says. But for them to be there, respecting the law, the rule of law, for the protection of themselves, their families, and the public. So the public should give them all the support for agreeing to, for obeying the law. So the public should not stigmatize them by no means, because it doesn't mean that they have the disease. We interact with them on a daily basis, many times a day. So we need the support from the general public. Thank you.
My question is, we understand that some people flee or escape the quarantine centers and now wandering in the society. What have your ministry done actually to trace out those people? And the second question is, you've talked about campaign, sensitization campaign. Is your ministry considering collaboration or partnering with civil society organizations to go into the upcountry to sensitize people? Because if you look at it, only those people in the urban area are taking this seriously, but when you go to the rural areas, it's rather unfortunate, pathetic that some of them do not even observe the measures that have to be placed.
Thank you very much. With regards to those who have escaped, our people have been following them, and fortunately, quite a number are understanding the implications, and they are voluntarily coming back. I can inform you categorically this is happening. They are voluntarily coming back, and our people have been encouraging some of them to really come back, and we have gotten most of them now. The last count was 8 out of the 14 have already come back. So the remaining 6, we'll keep on following them, and eventually they'll come back. But I think they've realized that really, it is for the good of themselves, and more so their families. Because if they spend that period with their own families at home, and they happen to be infected, probably the first set of people who may be infected are going to be their immediate family members, because they spend the time with the family members. So for that reason, many are coming back to the quarantine centers for them to undergo the process. So we're following that up. With regards to the communication, it is ongoing. Our Department of Health Promotion, we have a risk communication unit of our whole response team. Our National Health Emergency Committee has under that a subcommittee that is responsible for communication. And they have been very, very active. They are the ones who have been going to the TVs, to the radios, to the newspapers. I guess they've spoken to all of you. They have developed and circulating posters, billboards. They have engaged the community leaders. They have engaged the Kanyalan groups to talk to the people in the communities. Before the schools closed, they had engaged the schools. They are engaging the opinion leaders in the community. The National Assembly members have been engaged. We are in close collaboration with the National Assembly members, and they have all gone back into their constituencies as we speak. you know, and the message is being spread across. You know, each constituency has a National Assembly member. So if those members go to the constituencies, that means the entire country is covered, isn't it? Just by collaborating with the National Assembly members who have been very passionate, just as ourselves. So we are engaging each and every one of the community. You know, of course, you also know the religious leaders are on board. They are sensitizing the people. They are giving them the religious aspects of the campaign, of the response, and which has strong religious justifications. They are also being engaged. Other scholars are being engaged. Ordinary people, youth, the youth are being engaged. We've had a lot of youth groups who have come here to meet with the team. They want to be equipped with the knowledge, with the skills to send the positive message across, or the prevention message across, so that people continue to stay negative. Now, the student nurses, the University of the Gambia students are on board. The Students' Union members, executive members, are meeting with us on Monday. They called me a few days ago. They want to interact with us so that we equip them with the knowledge and the skills and the equipment to send the message across, and they want to go to the communities. So it is a continuous process, and we urge each and every one of us to do so. You are doing very well yourselves, the media personnel, but we also want you to engage your peer groups. You are role models for a lot of young people. They see you on TV, they hear your voices on radio. When you talk to them, they will listen, so that we stop this attire booze. People still are grouping together to drink attire, grouping together. Let's spend more time indoors and you know, stop grouping together to drink attire. Let us stop this socialization that we've been used to. It is inconvenient, but I think it makes sense. I think we can learn from China a lot of lessons. China, you can see the decline of cases in China, but you know that their response was very, very, very aggressive. Now, we've also seen the otherwise in other countries and the consequences, so we can balance it. We have the opportunity to compare the two groups, those that were very aggressive in their response and those who were a little less aggressive in their response. And I think it is very important for us to be very aggressive in our response. You can...
Yeah. About the civil society you mentioned, the minister is right. We have a committee which comprises of all the civil society that are part of it. We have Asonet, we have Tostan, we have United Purpose. So now each of them, they are also going down to the community to implement activities in their areas of jurisdiction. Like for example, Tostan, we all know Tostan they are confined to Upper River region. So they are also being, you also think about Red Cross, the civil society, they are also part of our community. So they also, currently they are everywhere in the country. They are doing house-to-house sensitization. So you can see what they are doing. A lot has been happening. So all the civil society organizations that are operating at grassroots are part of our community.
Does it only stop at the sensitization aspect of it? Are you equipping them with some of the necessary materials that they need, like sanitizer and so forth? Okay. Sanitizers,
you've seen the councils that have been doing that, the other councils, the ministry itself is doing a lot of that, trying to distribute it to facilities, and facilities are also supporting areas where they can support. But that has been complemented by, I think you've been seeing what the other councils have been doing, what the municipal councils have been doing to support them, and with regards to hand washing facilities and sanitizers. You've seen that a lot. And then coupled with regards to, I think, IEC material, you've seen a lot of, if you go to anywhere in this country now, be it Upper River Region South, Upper River Region North, you will see the posters being placed all over the village. The National Assembly members, they have their megaphones, they are going to every village, and they're also distributing along the IEC materials. This is something that is also trying to raise awareness. So that's where we are going to do ask about communication. You're talking about, what we are talking about now is about logistics, and we are definitely working towards meeting, but we can also, this can provide the sanitizer to every individual. Because what we are now to do, we are now trying to trigger the communities to take action. That is by giving them the information, educating them, and then they will take action on that. That's what we are doing. And when they take action, meaning they will see belt first. So they have to go in for those things on their own. That's what we encourage. That's health promotion is all about that. Making health choices, the easiest choices for people. So they have to take action because they get information, they know the implications of the disease, so they can go and buy it. Or they provide buckets where they can do hand washing at a low cost, because we want to promote low cost interventions. If they don't have buckets, they can do the tippy taps, which is no cost. You've seen the tippy taps, we've been working on that. So a lot of things can happen at community level at no cost, and they can get equipped with the knowledge and skills for them to be able to protect themselves. So that's a lot that has been happening. And I'm sure we are trying to go out with the media to see what is happening, what the ministry is doing. Then we are not going to talk. Then you will see things for yourself. Then you will appreciate what the ministry is doing at all levels.
On that note, I'd like to end.
Follow question?
Okay. Monday. Thank you very much, gentlemen and ladies of the media. Thank you, Honorable Minister. Apologize again for the water. We hope that, it's obvious that, after the next press conference, we will at least be taken care of. We are working for you. At least if somebody can be donating us water. The Director, Dr. Vijay, Director of Health Services, and everyone, thank you very much, and I declare today's media briefing for close. See you on Monday.
See you Monday. The time will
abroad and want to build your dream home in the Gambia without risking your funds and family ties? Do you want a household name that is trustworthy and efficient? A name that will continue to give you updates on the project from the beginning to the very end with videos and pictures? If your answer is yes, then worry no more. Boss Construction and Asset Management is here for you. If you live outside the Gambia and want to build your dream home, then this is ideal for you. Just reach out to Boss Construction and let's start building the dream home into a reality. With Boss Construction, the difference is clear. We give you value for money. Some of our services includes the following: construction management, building equipment rentals, rent management, purchase and leasing, asset management, and many more. For more information, please contact 282-4945. Better still, send us an email, bossgambia@gmail.com, or you can also visit our website on www.bossgambia.com. Boss Construction, a name you can trust. Boss Construction and Asset Management, keeping families together.
No lañ def ñooy ñëw ak yéen rek Skin Care Plus nara jàkkaarloo ak yéen waxtaan ak yéen tuuti rek si suñu tube suñu baax emuñ rek ci ay diw waaye comme ni ngeen ko xamee rek dañoo yëngu ci ay tube te yënguwuñ nag si just any tube suñ tube bu nekk 5-star jesna la 5-star jesna mooy jesna bi gën a pire moom la ñoo tube palmaan bi gën a fort moom la ñoo liggéeyee ñun rek si tube dara du doy day des not only dañoo tube but bu la neexee ñu tuubal la ba pare nag ñawal la. We're not all about skin. We are skin, care, and the plus. And the plus does come in so many different ways.
roy kañu